Hi guys, I'm gonna try to make sure that you're able to see. So yes, we are on the floor. Um, so I'm gonna do the abdominal assessment. I'm Stephanie, and I'll be caring for you today. We're gonna do the abdominal assessment. At any point of this assessment that you may feel uncomfortable, just stop me and let me know, and I will do my best to change up the position or do whatever that makes you feel comfortable in completion of this assessment the correct way. Is that okay?
Yeah.
Okay, so first I'm going to inspect his abdomen. I'm going to look for shape, any pulsations with the aorta that sits slightly, a little bit, couple of inches above the umbilicus. And then I'm also going to look at his work of breathing, making sure that he's not using these accessory muscles for any breathing. I'm also going to look at if I can see his bowels, any waves of bowels in any quadrant of his body. So moving along after inspection of his abdomen, I will then look into auscultation. So for auscultation, I want to listen to each area of his bowels, which would be the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. So when listening to his bowels, I want to notate whether they're hypoactive, hyperactive, and they should be anywhere from 5 to 30 minutes apart. So with that being said, I will then begin the assessment by listening to his bowels in the quadrant stated. Okay. So next, I will listen to his spleen or his liver, and what I'm listening for is any hepatic or any spleen rubs in those areas. I will start by listening to his liver, which is located on the right side of the body, and then next to spleen, which is on the left side of the body. And I will do so by using the diaphragm as well as the bell. Okay, so next with the abdominal assessment, I will then listen to the aorta, as I stated before, inches above the umbilicus. So I will listen for any brewy sounds when listening to the aorta, and then move down to the iliac arteries as well as his renal arteries, and followed by the femoral arteries. Also the bell, moving down to the. I won't pull his pants down, but the femoral artery will be right here. Also the bell on each side. Okay, so moving along with the abdominal assessment, I will then begin to percuss each quadrant. I'm listening for a tympanic sound. It should be air that, and it's not dull, which could mean that he may have ascites in the abdomen. So I will do so by starting as I did with the auscultation on the right upper quadrant, moving along to the left upper, right lower, and left lower. Okay. So then I will move along to percussion. So I will percuss the liver border and also the percuss the spleen. So I want to also I want it to change from tympanic to dull. So I will go on the right side here and I will start from the bottom. And then the same side as on the spleen. You want to percuss. So then next, what I want to do, and note that on the spleen side, it's a little harder because it sits like, I think, in the 10th intercostal space. Also, I want to then begin to palpate the abdomen. So before that, I want to notate why my patient came in, if they haven't any tenderness, and as I go along, ask them any tenderness or any pain in that area. So I'll start by the right upper, just palpating, and then moving along, and then the right lower, any tenderness or any pain. Okay. So also with palpations, that's just to get it started, just kind of a light palpation for any tenderness. As you can see, my patient didn't jump or didn't frown, grimacing or anything, so there's no pain noted there. So then I will begin doing a deep palpation on each side. A little deeper. Okay. So then I will move along, and also I will say that for the spleen, for the liver, you can do a hooking technique here to see if the liver is felt. You can have your patient to do a deep breath, and sometimes you can feel like the rebound of the liver there. You shouldn't be able to feel the spleen when doing that technique, because then it will mean that you have an enlarged spleen. Um, Also, I would like to just notate that you want to check for, well, I already said you have to check for any tenderness, but that's also the Murphy sign that also looks for cholecystitis as well. And then the right upper quadrant, if you feel any type of tenderness with palpations here, and you want to feel that can mean that you may have issues with the gallbladder as well. So that completes the abdominal assessment. Thank you.